Aloha, everybody. Thank you for joining us this evening on our Neighbors Helping Neighbors Forum. We are going to wait just a few minutes as folks start to trickle into the room. So if you can just bear with us for just a few minutes and we'll get started shortly. Thank you. Okay, I think that's everybody who is trying to get into the waiting room. So we'll just get started. Aloha, everybody. Thank you for joining us this evening for our Neighbors to Neighbors Forum. My name is Jacob Aki, and I'm the Director of Communications for the Hawaii State Senate. This evening's event was spearheaded by the Office of Senator Bennett Luca in collaboration with the Department of Human Services and the Department of Labor and Industrial Relations. And really this forum seeks to inform and empower advocates, ministry outreach volunteers, and other people on what state agencies, social services are available to help those in our community that are in need. Tonight's presentation and forum is the second one that we are having. We had one last week. This is the second one, and we'll also be holding our last one next week. But tonight's forum is really focused on the topics of MedQuest and childcare subsidies and licensings at the Department of Human Services. Per the script, I am now supposed to hand it over to Senator Luca, but she does send her apologies. She's currently in conference committee hearings voting, so she will be joining us a little later. So we'll be having her give a few remarks at the end. So at this time, I would like to hand it over to Catherine Korinaga, who's the Director of Community and Project Development at the Department of Human Services. So Catherine, the floor is yours.
Mahalo, Jacob. Aloha and welcome. My name is Catherine Korinaga from the Director's Office. We celebrate you and applaud your commitment to helping your neighbors. We admire your dedication to learning more, and thank you for joining us tonight. Director Kathy Betts is also unable to join us tonight. She sends her apologies as she's working on legislation as well. So I have the privilege of introducing our Deputy Director, Joseph Campos, who's not only super intelligent, but also very human. So you may hear children, you may hear dogs, you may hear other voices or possibly even the television. So please forgive us. We're coming from our home to yours. Please go ahead, Deputy Campos.
Good evening and aloha, everyone. In addition, I'll just add one more thing. My neighbors' children are practicing their baseball. And so you may also be hearing pings of the bat as they practice. So apologies for that. And as Catherine mentioned, Director Betts sends her regards and apologies that she's not able to attend this session as she is working on legislative conference reports at the moment. So if we can move to the next slide. So today we have both people from our MedQuest division, Meredith Nichols, who is the Assistant MedQuest Administrator, Puanani Crab Parker, who is the MQD MedQuest Healthcare Outreach Branch Manager. And then from our childcare division, we have Stacy Tonouchi. She is the Benefits, Employment, and Support Services Division Childcare Subsidy Program Administrator, and Dana Luca, Benefits, Employment, and Support Services Division Childcare Regulations Program Administrator. Next slide, please. So here at DHS, we have a guiding principle, and it's stated in Article 9, Section 3 of the Hawaii State Constitution. And it reads, the state shall have the power to provide financial assistance, medical assistance, and social services for persons who are found to be in need of and are eligible for such assistance and services as provided by law. And one thing that we want to stress is the fact that we do use the word persons and not citizens, because there are many services available within the Department of Human Services to people who are of mixed citizenship households or who live here and are not citizens. One such example is with the Medicaid program, which is handled by our MedQuest division. The Congress of the United States passed in 2020 the fact that people of compact nations who are residents are able to receive Medicaid if they qualify and are eligible. Next slide, please. So one of the other guiding principles that we abide by here, and I apologize for my dog, there you go, is the Aloha spirit. The Aloha spirit is really just, a sense of bringing people together, and each person helps each other. And let me just go on mute and ask my dog to be quiet for a minute. And if you can go to the next slide. Okay, apologies for that. I'm glad Catherine mentioned about how we are all human and have the different noises that exist within our households. So another kind of guiding principle within the Department of Human Services is our sense of ohana nui, which is a multi-generational approach. And what this is designed for is to reduce intergenerational poverty. And the way we go about this is to ensure that we have within our staff multi-generational staff that are concerned about the people of Hawaii, all the people of Hawaii, whether they be newborns to our elderly population. Next slide, please. And this is a slide that we like within the director's office. It's from the late Justice Ruth Bader Ginsburg. And it's fight for the things you care about, but do it in a way that will lead others to join you. Some of the issues that we address within the Department of Human Services are very difficult issues. And this is sort of where we come from. We want to fight for the things we care about, is ensuring that the people of Hawaii thrive. And we do it in a way in which we can have allies across the state. And I will mention that Senator Mizalucha has been a great ally of the Department of Human Services, and her care for the people of Hawaii, comes out in spades. So just a thank you to Senator Mizalucha for all of the help that she provides to the Department of Human Services. Next slide, please. So what is DHS? So this slide represents who DHS is and what we are. We serve about 1 in 3 Hawaii residents. Our operating budget is $3.8 billion, and that's for fiscal year 22 to 23. We have 84 offices statewide, 4 divisions, 2 attached agencies, 3 attached commissions, the governor's coordinator on homelessness, staff offices, 2,300 positions within the department, a multi-generational staff, as well as a bilingual staff. Next slide, please. And so the 4 main divisions of the Department of Human Services are the Benefit Employment Support Services Division, of which you'll hear from today in our child care subsidies programs. And they cover financial, SNAP, low-income home energy assistance, child care subsidies, child care licensing, employment training and support, and homeless services. Then we have the MedQuest division, which you'll also hear from today, and that's the medical insurance coverage, Medicaid, premium subsidy, long-term care, age, blind, and disabled, health analytics program, including all payers claim data warehouse. Then we have the Division of Vocational Rehab, which handles independent living programs, the State Rehabilitation Council, Ho'oponopono Services for the blind and employment training, and then the Social Services Division, which handles our child welfare services, domestic violence programs, adult protective services, adult foster care programs, senior companion programs, respite companion programs, foster grandparent programs, transportation assistance for resident aliens and naturalized citizens, and courtesy services. So as you can see in this slide, the Department of Human Services does quite a bit, and we are grateful to our excellent staff. Each one cares for the people of Hawaii, and again, our main goal is to have the people of Hawaii thrive. Next slide, please. So here's just a kind of a graph, a symbol, I'm not sure what you call it, of the DHS. And so DHS in the middle. And then we have our attached agencies, which is the Hawaii Public Housing Authority and the Office of Youth Services, which covers the Hawaii Youth Correctional Facility as well as the Youth Commission. And then we have commissions, the Hawaii State Commission on the Status of Women and Hawaii State Commission on Fatherhood. And then we have the Hawaii Interagency Council on Homelessness, which is in the Governor's Coordinator on Homelessness office. Next slide, please. And so now, Catherine, do I turn it over to you or do we just go straight to Meredith?
Yes, thank you so much,
Thank you.
Deputy Director Campos. We appreciate your sharing the depth and breadth of all what Human Services does and is about. Next, we're going to hear from MedQuest. So I'm going to introduce to you Meredith Nichols, who's the Assistant MedQuest Administrator, and Punani Crab Parker, who is the Healthcare Outreach Branch Manager. Please go ahead.
Mahalo, Catherine, appreciate it. And Jacob, we can go ahead to the next slide. And aloha, I am Meredith Nichols, and really grateful to you for joining us tonight as our neighbors, prepared to help our other neighbors. We appreciate you taking the time to learn more. Before I go in depth into this slide, and Joel already very nicely covered sort of a basic of what MedQuest, which is Hawaii's Medicaid program, what we do. I'll just pause a little before I get into this to say that we are a program that is both federally and state funded. One of the big differences between Medicaid and Medicare that people struggle with sometimes, including my own family and relatives, like, hey, you work for Medicare, right? I'm like, no, Medicaid. Same thing, right? No, not really. So Medicare, when we think about Medicare, we think about our kupuna, those 65 and older, perhaps those who are living with disabilities. That is a federally funded program. The difference with Medicaid programs is it's a jointly funded state dollars and federal dollars. And because of that joint funding, every state's Medicaid program operates differently because states have some choices in how they want to execute their Medicaid programs. So people sometimes will move here or move away from here to other places and make assumptions that Medicaid is going to be the same wherever they go, and it's just not true. It's different in every single state. So we'll just be focused on what we're doing here in Hawai'i. So you might be wondering, why are we seeing a slide that says HHS, which stands for Health and Human Services, rather than Medicaid? And it's because I wanted to cut to the chase and start with what I believe one of the biggest burning questions is, which is, we've been in a public health emergency since March of 2020, declared by the Secretary of Health and Human Services. What that has meant for Medicaid programs is we have the permission to keep everybody who was on Medicaid effective March 2020. Everyone has been able, who was already on Medicaid or who qualified for Medicaid since that time, everybody would stay enrolled with no threat of becoming disenrolled. The only people, in fact, who get disenrolled are people who voluntarily call and say, oh, thank you. I no longer need MedQuest anymore because I have a job. I have insurance through my employer. So voluntary closure, or they move out of state because we can only keep people insured who live here in Hawaii, or they pass away. So those are the only three reasons why people would have been terminated from coverage during this pandemic time. So then the big question becomes, what is this pandemic time, right? We heard from Governor Ige earlier today at his press conference. We're moving into a new state of being, a new state of public health management rather than pandemic management. We're taking our cues also from Health and Human Services federally. They're the folks who decide for us when the official public health emergency will end. And once it does, we will start to redetermine all of those cases. And I'm going to show you in a couple slides how many cases we're covering now. The slide I have in front of you shows the most recent extension of the public health emergency. Secretary Becerra does this 90 days at a time. That's what they're allowed to do. And so you can see if you read all the details in the slide, when it was first declared, which is January 27, 2020, a public health emergency has existed. And then every 90 days from there, you will see it renewed saying it continues to exist. And so these special rules continue to be in play. I will tell you, this was just signed off on. You can see here April 12th, but it was actually announced April 16th. And I can tell you that it has been widely believed that this will be the last 90-day extension, which would take us into mid-July. And if this is not renewed again in mid-July, then we will begin the work, like so many other states, of, you might hear referred to as unwinding from our continuous coverage requirement due to the expiration of the public health emergency. Excuse me. Now, if that doesn't happen, and if it's renewed again, at some point, we will begin to redetermine cases and people may be terminated, but that will not happen until the public health emergency is officially declared over by Health and Human Services. Next slide, please. All right, so how many people is this going to impact? So let's take a look at what the MedQuest numbers are right now. Next slide. Mahalo. All right, so here's our very colorful slide. I want you to focus right now on the green line you see. That's 2019, or what are calling our pre-pandemic normal year. And that green line is reflecting how many applications we receive on a weekly basis from the community. Now, these are not enrollments, these are applications. So then after you kind of check out the green line, train your eyes to the purple line, 2020. You'll see that in March of 2020, that's when the applications for coverage of MedQuest coverage really spiked and doubled, right? And so we see that continue to be really high throughout the remainder of 2020. And then in 2021, we still see a high volume, but kind of normalizing until almost mid-year, and then dipping slightly below this red line, dipping slightly below that green kind of normal number of applications. And then here we are in 2022, crazy that we're tracking 4 years worth, right? Where we see far fewer applications coming in. Now, we believe that it makes complete sense that the number of applications are trending downward because we're not disenrolling people, right? So those people who are covered are covered. You will see this data is effective April 9th, and you'll see from the beginning, from March 2020 to April 9th, MedQuest has received and processed 160,885 applications for coverage. Next slide, please. So here's the juicy slide, right? Here's enrollments. So I showed you how many people applied. This is how many people have enrolled so far. Now, again, this data is that we're looking at on this chart is effective April 11th. We had, and look at this crazy magical number, right? 444,444 human lives in Hawai'i covered via MedQuest. That's about almost 1 in 3 people. So you look to your right, you look to your left, somebody's covered by MedQuest. And all of you who are listening to this, who are working with the same population, who are part of our covered population, you know how vitally important this coverage is to our people. That 327,119 you're seeing in March 2020 represents a pretty, that's what we were in March 2020. And you can see from the line preceding that, pretty stable throughout. We have people come and go, but pretty much you can see around that 325-ish, a little above mark. So this demonstrates a 36% increase in the number of lives covered in these past 2+ years. Next slide, please. And we think it's always interesting to make sure we're tracking county by county what that looks like. So you will see the largest increase has in fact been in Maui County. So a 41% increase there, followed by a 30% increase on Kauai. And this is an increase from March of 2020, right? And then followed by a 37% increase on Oahu and a 30% increase on Hawai'i Island. Next slide, please. All right, so I showed you all of that, right? Like there's a lot of people. So what are we gonna do when we talk about the end of the public health emergency and our need to redetermine eligibility for all of those applications? So we are motivated by this olelo no'eau. A'ohe hana nui ke alu'ia. No task is too big when done together by all. And this is especially why I'm so grateful to all of you for being here with us, because you're part of that, right? Next slide, please. All right, so these are some strategies we're deploying. I'd love to hear your feedback later on this. But some of what we're doing, and the biggest takeaway, if you're writing anything down like, oh, how can I help? How can I help my neighbors? It's really important that people are contacting us to update their contact information. If I'm talking to my auntie at Foodland and she's like, wait, what's going on? What do I have to do? I would say, make sure if you moved and your phone number or your address changed, make sure you contact us and let us know so we can update it in our system. We believe if we have good contact information, everything will run far more smoothly. We are also very aware that during these tumultuous last couple of years, people have had to move from necessity. There have been evictions. There have been people over the period of time unable to maintain their rent or their mortgage where they were and had to move into a new place, maybe sharing housing with someone else. And it may not have been at the top of their mind because they're just struggling to survive and make ends meet. Oh yeah, and I got to remember to call MedQuest and give them my address. We get it. Things have been a little rough for people. So we're gonna embark upon a campaign to remind people, please let us know your new contact information. We also plan to leverage community partners. And so all of those feet on the street that are meeting with people, our pastors in the community, our nonprofit organizations, our community groups, and our fellow government agencies, all hands on deck if we can get that word out to help remind people to update their addresses and phone numbers. Another strategy we're going to use is something we're calling a pink letter campaign, because we get a lot of mail, right? So we decided we're going to make a change and say, if you get, MedQuest is going to be sending out our notices when it's time to send them out in pink envelopes and on pink paper. So if you open the envelope, we didn't want it to be a regular white paper, right? Because it might not stick with people that it came in a pink envelope. So we're doing both. Pink envelope, pink paper, to let people know, hey, we just reran your eligibility. It looks like we need a bit more information from you. Can you please send us whatever it is we might need? We want to make sure that our mail stands out because, so first of all, right, we want to make sure it goes to the right address. So that's why the address update. Second of all, we want to make sure that people are aware that this is something we need to pay attention to. We got to look at that letter and see if it's asking us to take action. And if it is, that we're taking the action to maintain our coverage. Medical coverage is so important to our people, right? We've also updated information on our website. If you go to medquest.hawaii.gov, it's a really, I'm kind of proud of it. I think it's a great website, lots of information. So again, medquest.hawaii.gov. You'll see a little banner there reminding people to update their addresses and a little information on how to do that. But you also see a lot of other information like access to forms for how to apply and different rules. What kind of things do you cover? It's all easy to find on our website. Okay. Elected officials, thank you to Senator for having us on here. This is exactly the kind of opportunity we want to leverage to help share the information with the people. And I've already talked about agencies, community, social groups. We work at MedQuest, right? So we're not the doctors, right? People don't come to MedQuest to get healthcare. But what we do is we partner with health plans who are called managed care organizations. Sometimes you might hear it as MCO. It's just an abbreviation for managed care organizations. And they're also helping us so that if somebody didn't call us, but maybe they went to their doctor and they said, oh yeah, I have a new address. The doctor can update the health plan. We have 5 health plans, right? Kaiser, HMSA, Ohana, United, and Aloha Care. So those health plans have been giving us a regular file of anybody whose address has been updated with them so that we can update their Medicaid case. So these are the actions we're already taking to make sure we have good records. And then if we do get return mail, and we know we will, our team is already aware. We're going to make every effort to contact someone. We're going to look in their case file for their phone number. We're going to try to call. We're going to do everything we can to avoid terminating coverage. At the end of the day, if we cannot reach people, if we cannot validate that they still live here, because we also know a lot of people moved away, right? If we cannot validate that somebody still lives here in Hawaii, then it is likely their coverage will be terminated if they're no longer eligible. Next slide, please. All right, and I won't go into detail on this, but I will tell you, again, key messages, right? Update your contact information, check your mail, and if you get a pink letter, read it and make sure you complete it and get it back to us. So those are the top 3 of everything I just kind of said. Those are the top 3. And then there's going to be people who are no longer eligible. Maybe they're making a little more money now. They're not financially eligible. And you'll hear from Puanani in a couple more slides. We have a fabulous team of people that can help people if they need help accessing health insurance through healthcare.gov. It's also called the marketplace. Some people call it Obamacare. Really great plans there. You'll see from this slide, super affordable. 4 out of 5 enrollees can find plans that are less than $10 a month. So again, that's the affordable part of the Affordable Care Act. So it's our intent to make sure anybody who's covered does not slip into somebody who's no longer insured. If you can't still be covered by MedQuest because you're not eligible, we want to make sure we get you hooked up on the marketplace. So that's the effort we'll be taking, and all of you can also help with that. Anybody can go on healthcare.gov and apply. Next slide, please. All right, so I told you a lot about this already. Medicaid renewal letters are going to be coming in pink envelopes. Again, it'll be dependent on when we find out from Health and Human Services whether or not this will be renewed again. If the public health emergency is not renewed in July, then pink envelopes will start to go out in August. Next slide, please. All right, and here's just some samples of material that you'll start to see in the community. Get ready to renew now, where MedQuest is going to start, because people have been used to, it's just been, their MedQuest has been continuing on without question for over a couple of years. So we don't want anybody to be blindsided. So we want to make sure we're getting the word out and people are aware. Next slide, please. Okay, and again, this is just a repeat because I know for myself, I have to hear things like 5 times before it really sticks. So we're updating contact info, we're paying attention to the mail, looking for the pink letter, and if it contains a renewal form, we want to make sure we're filling that out, providing whatever is needed so that we can keep people insured if they're still eligible, and if they're not, we're helping connect them onto the marketplace. Next slide, please. And this is where I'm going to bring one of my favorite human beings, Puanani Crab Parker. She heads up our MedQuest outreach branch. She has people who are active on various islands who are helping, again, just like you folks, neighbors helping neighbors in the community. So Puanani, I welcome you to join.
Hi, aloha everyone, and thank you for joining us this evening. Again, I'm Puanani and I'm with MedQuest. I help lead the outreach branch statewide for MedQuest. And there's different ways to apply. It can be very easy. If you have access online to a computer or a smartphone with internet, you can apply online by creating your own account and then completing the application online at medical.mybenefits.hawaii.gov. The link is on the screen. You can also call and we can do your application over the phone and submit it online that way. On Oahu, you can call 808-524-3370. And for those friends and family who may be on the neighbor islands, there's a toll-free number as well that we have listed along with our TTY numbers. There is also help from your community partners. Now on our website, where Meredith had stated our website is medquest.hawaii.gov. I've also provided a link here in the resources tab. There's a community partners section. When you click on that, it will list out for you all of the different counties where we have community partners who have people within their organizations who can help you complete applications either at MedQuest or the Federal Health Insurance Marketplace at healthcare.gov. So I encourage you to take a look at that because again, many times the community partners are places such as our federally qualified health centers and other community organizations like Legal Aid Society of Hawaii. We are Oceania and Kumukahi Health and Wellness. So we have many of our partners online. There are in every county and close to almost anyone who may need help. So I encourage you to look at that if you would like to get some help within the community. And lastly, we have our PDF fillable application. You can go ahead and print that out once you've completed it and deliver it to a MedQuest eligibility office nearest you. So, and the other thing I would recommend is if you're really having a rough time or you have friends and family who are having a difficult time and they've lost their coverage and they don't know what to do, don't sit and think about where you might be eligible or try and figure out whether you're eligible here or there. Because at MedQuest, if you apply and you're not eligible because maybe your incomes exceeds the threshold of our eligibility limits, we will also transfer your information via an electronic secure file transfer to healthcare.gov. And then, if you come to one of our community partners or come to us for help, and we see that you're not necessarily eligible for MedQuest, we can also help you enroll onto the marketplace as well and see what kind of government subsidies that one might qualify there. So again, my message is don't try to sit and figure out really where you might apply, because again, you can get benefits one way or the other from either of these locations, either at MedQuest or healthcare.gov. Next slide. I think that's it. Thank you.
Mahalo, Puanani and Meredith, for sharing about MedQuest, and in particular, sharing with our neighbors here and how they can help. I think the pink envelope and pink letter is brilliant. Next, we would like to share with you about childcare subsidies. So what we found, of course, pre-pandemic, is that we want for our children quality care as well as education. What we found, what was magnified in the pandemic, is how important childcare really is. Not only so that working parents and oftentimes single moms can work, um, but also for the benefit of children. So I'm introducing Stacy Tonouchi, who's our Child Care Subsidy Program Administrator, to share more about it. Please go ahead, Stacy.
Well, good evening. My name is Stacy Tonouchi. I'm the Child Care Subsidy Program Administrator for the department. Thank you for inviting me this evening. I hope to highlight some of our child care subsidy programs. Each family has different child care needs and preferences. Parents or caretakers choose the child care provider most appropriate for their child. Our job is to offer guidance and provide materials to help families make this important choice. I'd like to share information about two of our programs and introduce another program through our partnership with Department of Education. Childcare Connection Hawaii. This program provides subsidies to income eligible families to help pay for a variety of legal childcare settings, including care provided by family, friends, or neighbors, before and after school programs, and preschools. Keep in mind, all childcare providers, even if they are not licensed by DHS, need to have background checks completed in order for families to receive a DHS childcare subsidy payment. This is to help ensure that the child is in a safe setting. Our parents will receive detailed information about these requirements during the application process. In addition, parents or caretakers must be employed, attending an educational program, or participating in a job training program. Other eligibility requirements include residency. The child resides with a parent or caretaker in our state. Citizenship. The child is a U.S. citizen or lawful permanent resident. And an age requirement. The child is under 13 years old or 13 to 17 years old, and a licensed physician has verified the child is not able to care for him or herself. Families will receive assistance from statewide Child Care Connection Hawaii offices. Our TANF families, or our temporary assistance for needy families, will work directly with their case managers from the statewide First to Work programs. First to Work offers support services, including childcare assistance, to support families in meeting their work program requirements. Next slide, please. Our preschool open doors. Back in 2014, preschool open doors was established as the statewide school readiness program, providing subsidies for income eligible families with children in the year prior to kindergarten entry. The POD subsidy is used towards payments to DHS licensed group childcare homes or centers, or preschools, centers/preschools. Preschool Open Doors focuses on the child's school experience. Parents are not required to be in an approved activity, such as being employed or attending school. Next slide, please. Okay, childcare assistance for school-age children. DHS partners with Department of Education to provide tuition subsidies to needy families. This is a contract between the department's TANF program office and the Department of Education for children who attend DOE public and charter elementary schools for after-school childcare services through the After School Plus program, more commonly referred to as A+. DHS covers the full value of the A+ program monthly fee. Currently, the fee is at $200, and this is for each student that has been determined eligible for tuition assistance. The determination is made by the DOE coordinators at the A+ program sites. Next slide, please. Families receiving childcare services. This is to highlight how many families on average the department is working with. This is our March statistics. Childcare Connection Hawaii, we worked with 3,736 families and processed payments for 5,191 children. This is a monthly average. Preschool open doors, we service 541 families and process payments for 555 children. And for A+, through the contract with Department of Education, DHS was able to support approximately 5,000 children by covering their full monthly A+ fees. Next slide, please. Thank you. How to apply? Let's see. So I'm showing two programs side by side. Very similar except for one difference. Obtaining and submitting applications, it's very similar. So applications for childcare services are accepted statewide, year-round, except for our preschool open doors program. This is the one difference. Preschool open doors will continue to have time-limited application periods established by the department. We just ended the spring enrollment period, which started January of this year and ended in March of this year. The department extended the deadline by 1 week to April 8th, 2022. We realized that the deadline was just when families were returning from spring break and may have overlooked the initial deadline of March 31st. They just wanted to be sure all families who are interested in applying for preschool open doors did not miss the opportunity for their young learners to experience a preschool setting. Our application can be found on the department's website, as well as Patch's website. Patch is People Attentive to Children, and they are our current provider for the preschool open doors program. If online access is not available for families, they may contact any of the statewide offices to request an application be mailed to them, to pick up an application during office hours, or to drop off a completed application. We also accept applications through mail, email, and through fax. Next slide, please. Okay, here's a sample of the application for childcare assistance. This is our DHS 911 form. The form is a single application for both Childcare Connection Hawaii and the Preschool Open Doors program. Back in 2020, at the height of the pandemic, the department made this change to a single application to reduce the burden on families who may be interested in applying for both childcare subsidy programs. Families make a decision if they will be applying for one or both programs, and our staff at the Childcare Connection Hawaii and Preschool Open Doors office work together to review the family's application. When our families include supporting documents with their application, it helps with the application process, as staff will not have to request the items and pen the application until the verification is received. For example, copies of the child's birth certificate to establish citizenship and the relationship to the caretaker, picture IDs for the adults to establish residency, and income verification if applicable to establish income criteria for their household size. Key families will be notified by mail of their application status. Also part of the application process is an interview. Staff must complete an intake interview to confirm information with the family. Once the interview is completed and all the requested documents are submitted, our staff will determine if a family is eligible for subsidy and the amount of the subsidy. Next slide, please. Here is a list of the Child Care Connection Hawaii offices and the Preschool Open Doors office. For this district, most of your families will work with our Waipahu office. Oahu is divided by established census tracts. So there are pockets that will be working with our Honolulu staff. My understanding is Moanalua Road is the dividing line, but we will definitely get the families to their appropriate offices. Let's see. Actually, thank you for your time and interest in childcare subsidies. This concludes my portion.
Thank you very much, Stacy. We really appreciate your sharing and walking through the application process and types of child care subsidies. Just want to also note that Jacob, who sent out your Zoom link, will be sending these slides. And in this slides that will be sent to you will have the hyperlink so that you can easily get into the web pages. We know that within our department website, it's difficult to actually find those exact pages. So he will be sending that out to you with the recording of the session. Next, I'd like to introduce Dana Luca, who's a Child Care Regulations Program Administrator, to talk about child care licensing and how it might apply to the families that you help, and possibly an option to families as well that they could use within their own homes or, in your neighborhoods. So Dana, would you please share more about childcare licensing?
Sure, thank you, Catherine. Good evening, my name is Dana Luca, and I am the Child Care Regulations Program Administrator. Our Child Care Regulations Program Office provides policy and administrative direction in the development and implementation of child care and programs such as the Child Care Licensing Program. So do you know a family that needs child care? Or perhaps you may meet a family who needs child care but doesn't know what kind of care is available or what kind of care is best suited for their child. Tonight, I'll talk about the different types of child care, briefly mention some of the health and safety requirements that licensed and registered family child care homes and group child care centers must meet. I'll provide you with resources that are available to families who are looking for child care. And last, how to become a registered family child care provider. Next slide, please. So one type of child care are licensed child care centers. What does licensed mean? According to the Hawaii Revised Statutes 346161, no person shall operate, maintain, or conduct a group child care home or group child care center unless licensed to do so by the Department of Human Services. Licensed means that a license certificate was issued to the child care provider to operate the child care center. A license certificate is issued when the child care center meets the health and safety requirements that are established by administrative rules. Some examples of the health and safety requirements are child care center staff members must have cleared criminal history and abuse and neglect background checks, must have written policies and procedures for the operations of the center. For example, communication with parents, staff assignments, emergency care provisions, nutrition components, and cleaning and sanitation practices. And they must be qualified for the positions they hold, such as director, teacher, and aide. Licensed centers have monitoring site visits that are conducted at least twice a year to make sure that the child care center is in compliance with the rules. Additional visits may be conducted when there is a complaint or other concerns. There are different administrative rules for the different types of child care centers. DHS licensed child care centers are group child care facilities such as preschools, which serve children ages 2 to 5, group child care homes, which also can serve children ages 2 years to 5, but children may be younger than 2, infant and toddler centers that serve children age 6 weeks and older, and before and after school and summer programs that serve children enrolled in kindergarten and above. These are center-based, meaning their typical environment is of a classroom type. The number of children in a classroom is dependent on the square footage of the room and the number of qualified staff available for that room. Next slide, please. Thank you. So registered family childcare homes are another type of childcare. And what does registered mean? So according to the Hawaii Revised Statutes 346-171, it means that no person shall operate or maintain a family childcare home unless registered to do so by the Department of Human Services. A certificate of registration is issued when the home meets the health and safety requirements that are established by administrative rules. Some examples of the health and safety requirements are all adult household members must have cleared criminal history and abuse and neglect background checks. They must have written operational policies and procedures for things like emergency medical care, their hours of operation, what they plan to do if a child becomes ill. And they have to have a home that is safe for children. Monitoring home visits are also conducted at least twice a year to make sure that the child care home is in compliance with the rules, and additional visits may be conducted when there is a complaint or other concerns. Anyone caring for more than 2 children that are not related to the child care provider through blood, marriage, or adoption must be registered by the department unless the person goes into the children's home and cares only for those children who live in the home. A registered family child care home provider may only care for up to 6 children at one time. And of those 6 children, only 2 of them can be under the age of 18 months old. This is to make sure that the caregiver is able to meet the needs of all children in care and provide supervision at all times. There may be times when up to 4 children under the age of 18 months may be provided care at the same time, but this is only when there is additional help by another adult. Next slide, please. So how do you choose a type of care? Some families may not know which type of care to choose. Some may decide to choose both types when their children are at different ages. So for example, some families may use a family childcare provider when their children are younger, and then enroll their children in a preschool when they're older, like 3 or 4 years old. For families that prefer a smaller group of children or want to keep their children in a home-like environment, a registered family childcare home provider may be a good fit. For families that prefer more structure or perhaps want to provide their children with a different learning-based approach, a childcare center may be a good fit. Here are some examples of what are important to families and how they choose a type of care. Sometimes it's based on location, cost, or who their family or friends have used. Whatever the choice, we know that it's a difficult decision for families to make because they are entrusting someone they barely know to care for their children. Next slide, please.
So these are resources. Where can families start to look for licensed or registered homes and centers? DHS contracts with Patch, People Attentive to Children, and is Hawaii's statewide childcare resource and referral service. They manage a database of childcare providers and programs. Referral specialists are available to assist in locating childcare providers in specific areas and provide information and resources to help families make informed decisions about childcare. A search of licensed and registered childcare providers can be done through Patch's database, and families can do their own online search of providers. Or if families prefer direct assistance, Patch staff are available to assist them in person or over the phone. Patch has an office on each island on Oahu, Maui County, East and West Hawaii, and on Kauai. Included in this slide is Patch's website address and where additional resources can be found, such as childcare training and scholarship opportunities, USDA food program, childcare subsidy information, and even careers with Patch. Next slide, please. In addition to Patch, the University of Hawaii Center on the Family's Learning to Grow project also provides resources on choosing childcare, which can be accessed through their website. Their Choosing Childcare booklet provides information on childcare options available to families. A Choosing Childcare brochure, which provides information on the process involved on what to look for in a quality childcare provider. And it's available in Chinese, Ilocano, Japanese, Korean, Spanish, and Vietnamese. And their Choosing Quality Childcare video highlights key points to consider in the childcare decision-making process. Their website is also here in this slide. Another resource that is available to families are our statewide childcare licensing units. As mentioned earlier, the childcare licensing unit workers are the ones who monitor registered home or licensed center compliance with the childcare law and the administrative rules. They also provide consultation and technical assistance to childcare providers. So depending on the location of a childcare provider, families may contact the assigned childcare licensing unit for information about a childcare provider's licensing or registration history, including compliance history. For more information about the childcare licensing units, the website address is included here. Next slide, please. These are the, so for childcare providers on Oahu they're assigned geographically to either the Childcare Licensing Unit 1 or the Childcare Licensing Unit 2. Childcare providers in the Halawa area are assigned to Childcare Licensing Unit 1, and childcare providers in the Aiea and Pearl City areas are assigned to Childcare Licensing Unit 2. If there are any questions about a childcare provider on Oahu, childcare rules, or if there are any concerns about a childcare provider, individuals should contact one of these childcare licensing units. Next slide, please. This is the contact information for the childcare licensing units in Maui County and Hawaii County, in case there are families in your neighborhood that plan on relocating to another island. Next slide, please. Okay, so do you know someone in your community who is thinking of a career with children? Or do you know someone who is really good with children and may be interested in starting their own family childcare business? Well, the reality of the number of childcare seats in registered family childcare homes, licensed group childcare centers, and group childcare homes have significantly decreased across the state, across the nation too. And the COVID-19 pandemic had a major impact on the decrease of the number of childcare providers. So if you know someone who is really great with children or who has thought of a career with children, the following slides will provide information on how to become a registered family childcare provider. Someone who is considering to be a registered family childcare provider may use the following questions to guide them in their decision. How do I know if I would be a good fit? Am I nurturing? Do I enjoy working with children? Do I have a basic understanding of what children need for healthy growth and development? Do I have the energy and stamina to keep up with children? Next slide, please. If the responses to the first set of questions is yes, then the following questions may assist an individual to determine if becoming a registered family childcare provider is right for the individual and begin the next steps toward the application process. So questions like, do I own or rent my own home? Will my family or landlord approve if I want to operate a childcare home? Can I make my home a safe environment for children? Will all my adult household members agree to do a background check? And am I willing to complete training to provide children with the experiences that will support their growth? Next slide, please. Applicants should read and review the Hawaii Administrative Rules, Chapter 891.1, the rules that govern the registration of family childcare homes and amendments. Patch is also a great resource and is available to assist individuals towards taking steps to becoming a registered family childcare provider. Patch is able to guide individuals with setting up their business. They're able to provide information on child development, nutrition, health and safety, just to name a few. They also have a plethora of resources available to providers, such as USDA Child Care Food Program, which assists in paying for meals served in childcare homes. And they offer free training classes that are offered online or in person. Patch is also available to refer parents to registered family childcare providers who are looking for childcare. And they connect providers with other childcare providers, with professional childcare associations and many other resources. Next slide, please. So this is an overview of the application process. The application packet must be completed, and it consists of an application form. All of your household members, adult household members, must agree to have background checks. They must have a physical exam, a TB clearance, and employment history clearance forms. This is how the department ensures that the home, which includes persons living in the home, are safe for the children that will be enrolled in care. Then after the application is submitted, applicants should start thinking about what their childcare policies and procedures will be for things like having a daily schedule and activities to provide children with. Cleaning plans, emergency care plans, nutrition components, if they're planning on providing meals and snacks, and forms like daily attendance records. Applicants should get their home ready for children. They should think about the materials and equipment needed, areas where childcare will be provided, and making sure their home is safe for children. Patch is a great resource to help with these areas. After applicants show that they are in compliance with the health and safety requirements from the administrative rules, a certificate of registration will be issued and they will be a DHS registered family childcare provider. This concludes our presentation. Remember that our statewide childcare licensing units are ready to assist, along with Patch, our contracted resource and referral agency. Thank you.
Thank you, Dana, for sharing. We appreciate your taking the time to take us through all of that. And once again, we will have these slides available so that you can look at it in more detail. So I'm going to hand this back over to Jacob now.
Okay, thank you. At this time, we are going to pivot a little bit. We do have Senator Misalucha, who is with us on the call now. So I'll hand it over to Senator Misalucha to make a few remarks. Senator?
Aloha, everyone. Thank you so much, Jacob, and thank you, Catherine, and those of you who are on Zoom. So aloha, and I want to apologize. This is the last 3 days for what they call conference. We're in both chambers, House and Senate, have to come together to agree to a version of the bill if the bill is to move forward. So we had a very late conference committee meeting or hearing for the Ag Committee, and it stretched on almost to 7 o'clock. So I apologize. I really wanted to be here to welcome you, but notwithstanding that, I'm here, and I just want to say mahalo for joining us for this second of 3 forums for Neighbors Helping Neighbors. So when the effects of the pandemic impacted our departments and agencies' ability to provide in-service or in-person outreach services, we had challenges, right? We had limitations in serving our community. So, and I know many of you Good Samaritans stepped up and you wanted to help advocate for those in need. So, but as you know, the experiences of our Good Samaritans have been daunting and it was quite confusing. So it's our hope that these forums will really provide vital information to support you who want to provide a helping hand. So I want to personally thank the following: Director of Human Services, Kathy Betts, Deputy Director Joseph Campos II, and Catherine Korinaga, who is the Community and Projects Director. So mahalo DHS for participating this past 2 forums. I want to also, of course, mahalo our Senate Communications Office with Jacob Aki and Chelsea for their support. We could not have done this without you, as well as Bernie Kaalem, who is our liaison from our office. So I wanted to just do something a little different and outside the box, if you don't mind. And I know there are some of you on the Zoom call that may be inclined to share feedback. I want to make this a little bit more interactive and ask you what you felt were things that you really gained from, especially for those of you who just joined us or who have joined us for the last 2 sessions. It's really important because we would love to tailor it for the future if we're going to do this again. And I believe we had great feedback that we would like to. So it may be on a yearly basis, not necessarily, periodically. But on a yearly basis, I think it's important for our agencies to touch bases with our communities. So, and I want to just say mahalo again for DHS, because this is outside the boundaries of regular office hours, but to their credit, they have such good hearts, such a sense of aloha for our community. So I want to thank you folks. So I'm going to ask if Jacob, if you don't mind not highlighting me, but maybe have a group, perspective, so that we can see everybody. And if you have a comment to share, we would love to hear from you what you thought. Just think about one thing. So, things that you thought were very important, or even just a general perspective of how these forums provided you with some information. I'm going to start with someone that I know is in the room, and she's not going to forgive me, but Carol Tano, are you there? Could you share with us your perspective And I know I'm putting you on the spot, so I apologize. You can tease me about it after this, but or Dean, if you don't mind sharing what you thought of the forum so far.
Oh, I thought the forums were rich, and I think the part of the department became very human to me. Every department section head were so it was heartwarming and it made me right away helped others that needed help that was on my mind. And I certainly wish more people had the chance to hear this, and I can't thank them enough for having this opportunity to learn all about the massive departments under each component that is involved with this. Thank you again.
Thank you. Thank you. Anyone else who would like to share?
Yes, thank you, Senator. I agree with Carol, being able to get to know the people and remember that all of us are in this together, and specifically seeing and knowing the streamlining of everything. Some of the outreach that I'm involved with, knowing that people just want to get forward. I do a lot of outreach with the homeless, and knowing that the forms have all been brought together in one document now. I was just working with some folks last night. They're ready to break the cycle, and they want to be off the streets, and they're committed. And the timing of your program, Senator, is perfect. And so we spent a couple of hours yesterday starting to go through all of that documentation. So thank you for that timing. It couldn't have happened at a better time. So we've already got some wins happening for us even now. So thank you.
You don't know how that warms my heart. I'm really getting now, seriously.
I mean,
so
honestly,
wonderful.
like the timing was perfect. And so if we can take some good out of this horrible pandemic, it's that the documentation that used to be in 50 different places, it's caused us to rethink this paradigm and streamline paperwork and simplify it that we know needed to happen. And we've started using technology in new ways we've just had to. And here we are, we're people, and we live on an island, and we've always known this. Here we are, and we're able to engage one another through a computer, and we've simplified everything. But we've gone back to the way that we've always done things here, through intelligence and through our own presence of mind. So thank you.
We have your contact information, sir, because
sure.
yeah,
I can
if you
put
can
it in
put it
chat.
on the chat, only because
Certainly.
we're actually doing an outreach on homelessness.
Oh, certainly.
And we are looking at not just short-term solutions, but long-term solutions. In our district, particularly, the bike path, there's talk about how the Navy is going to take over the management of that. And there's a lot of homeless encampments in that area. And if you do that, if we're going to sweep them, they're going to go they need to go.
Right. They're going to be somewhere. You can't.
Right.
I agree with you.
So
yes. I would be
need
excited. Yes.
to have some long-term solutions for that. And so anyway, Bernie, if you don't mind just checking up on and making sure.
Yes, I'll put it in chat.
Yeah.
Yes, absolutely.
Yes.
I do remember Mr. Neff when he called your office, Senator.
Oh, so Bernie, you already have my contact information.
Yes, so we have everything. And hello to everyone at St. Timothy's.
Aloha.
Wonderful. Okay, anyone else who would like to share? Great feedback. Don't be shy. We're all like local.
Oh no, I took over the room. I'm so sorry, Senator.
No. I don't want to start calling people out. So
I know we don't want to gang up on people.
no, but please, share. Like we're all friends here. We're family.
On the chat, there's one from Laura Lee.
Yes.
Are there special needs for childcare?
There you go. Question.
Hi, I can address that question. So are you asking if there are childcare facilities that provide childcare for children with special needs? I'm an RN that can provide to special needs. Oh, okay. So you would be a great resource to be able to provide to help provide care for children with special needs. Patch is a great resource also. They do maintain that database for us. They do collect that information on which childcare facilities are able to provide for children with that, that have some special needs. I hope I answered your question.
Okay. So what we're going to be doing is doing breakout sessions, sections, and Jacob will be providing that. If there are no other people who would like to share, we can go right into breakout, and once we're done with the questions, we can break out and be done with the forum. We don't necessarily have to, just for the sake of being and stretching the time. If there are no more questions, we want to be there for you. So Jacob, please go ahead and let's do the breakout for folks who want to ask more the specific questions and want to make it into a smaller, intimate setting.
Sure. Okay, thank you. So right now we are going to go into our question and answer breakout room time. There are going to be 2 breakout rooms, and you'll each have the opportunity to choose which room you want to go to. The first room is going to be on the topic of MedQuest, and then the second topic is going to be on childcare. So if our presenters who spoke on these topics can go to those rooms, and then for the rest of our audience, you have the opportunity to choose a room. We did decide that we'll probably go for about 20 minutes. We tried the 10 minutes and then switched last time, but I don't think it really, folks were getting so deep into their conversation that 10 minutes wasn't enough time. So please pick the room that you want to go to, and our presenters will be there to ask any question or to answer any questions that you may have. I'll give you guys about a 5-minute warning before I'll bring you back into this main room, but we'll go for about 20 minutes. So
Jacob, are they able to choose and they have to stay in that room, or can they go switch after that to go to the other room? I'm not sure whether what the timing is.
Yeah, so you can. So just you might have to come back to the main room, send me a message and I'll be able to send you to the other room if you want to. But
okay, sounds
at least
good.
for this initial one, you'll have the opportunity to choose. So
thank you.
the option should have popped up, so feel free to go. If you have any issues or it's not letting you, just let me know, speak up, or write it in the chat, and I'll send you to the room that you want to go to.
Hi, Jacob. Nothing popped up on my screen.
Okay, where do you want to go?
I'll just go to MedQuest and then I'll switch out midway through.
Okay.
Me too. I'll do the same for me, Jacob. MedQuest first.
Hi, Jacob, it's Stacy. I'm not getting that option either. I'll do
Okay.
childcare, please.
Okay.
You can send me to childcare with Stacy as well. Thank you, Jacob.
Yep. Okay, I think folks are slowly making their way back into the room, so we'll just give it about 30 seconds or so. Okay, how was the conversations? Good conversations, good thoughts, good everything. Senator, I know we are a little early. What I am, you want to?
No, if we're done, we're done. Don't worry about
Okay.
it. Yeah, I just want to make sure that people do have phone numbers or contact information. If they have additional questions that, may pop up later on as they're thinking more about their particular situation, that they're able to access the particular person who is pertinent to the conversation. But I just want to mahalo again the people from DHS. I mean, it really warms my heart as I'm listening to the conversations. By the way, I just realized someone who I know in a prior life, and Meredith, you're
I was just gonna call you out. I was like, I know Senator Vista. And it makes so much sense to me, I have to say, that you put this forum together. It's exactly who you are.
Oh, you're so kind.
Of
You're
neighbors
so
helping
kind.
neighbors and community voice. It warms my heart to be here and to know I was going to get to see you. And thank you so much for welcoming us and putting this together. So we had the opportunity.
You're so kind. Well, Meredith and I know each other when she was working for Olelo, and was on the board of Olelo for quite a number of years. Yeah. So, but mahalo again, and again, as I'm listening to the conversations, it's really just it just fills my heart with joy, just because I know that you folks from DHS, you're not just doing it just to get a paycheck. You can tell that you find joy in service as well, and for people, like us who in government, and as I was sharing with, some members in a chat, that this is how we build trust in government. This is how we build our communities to trust us more, and people like you enable and pave the way. So mahalo DHS, mahalo to Director Kathy Betts, as well as to Joseph Campos, and of course Catherine. I found this a very joyful evening. So we have one more event next year. See, I'm thinking already session next year. Next week. And it's actually the last day of session. I don't know, Jacob, I don't know what I was thinking of that this got scheduled during the ending of the session, but be that as it may, it still turned out beautifully and wonderfully. So I'm going to turn the table over to Jacob again, but thank you, mahalo everyone. And on behalf of a community, just with a grateful heart, mahalo for everything.
Thank you, Senator. And I think
if I can.
Yeah, sure.
If you don't mind. And Senator, we just wanted to thank you on behalf of Director Betts, as well as the entire DHS Ohana, for your insight to put this together. I think it was a great way to have outreach to the community, and we look forward to working with you in the future. So
thank you, Joseph.
Thank you.
Thank you. Yeah, and if we can give Senator and our staff at DHS a round of applause. I think the past 2 weeks has been a really good conversation, and really a good opportunity to know what services are out there for those in our community that really need it. So on behalf of us here in the Senate, mahalo for the work that you folks do. And a recording of this is going to be made available via YouTube, and as was mentioned earlier, we will be sending a follow-up with the slide deck that was shared tonight, as well as the YouTube link. So if you have any folks who need to watch this, or you want to go back and rewatch it later, you have the opportunity to do so. But once again, a big mahalo to the staff from DHS for taking the time over these past 2 weeks. We do have one more session next week, so please join us next week, May 4th. May the 4th be with you. But May 4th at 6:30 p.m. We hope to see you folks again. And this time we'll be having the staff from the Department of Labor and Industrial Relations do a presentation with us. But until then, stay safe. For those of you who are affected by session, let's finish the session strong. And once again, thank you guys for joining us, and we'll see you guys next week. Take care.
Aloha.
Hello.
Aloha.
Aloha.